A student has special educational needs if they have a learning problem or disability that make it more difficult for them to learn than most children their age. Disabilities are inherently ambiguous. Naming and describing types of them implies that disabilities are relatively fixed, stable, and distinct, like different kinds of fruit or maybe vegetables. As many teachers will later discover, though, the reality is somewhat different. The behavior and qualities of a particular student with a disability can be hard to categorize. The student may be challenged not only by the disability, but also by experiences common to all students with or without disability. Any particular disability, furthermore, poses problems more in some situation than others. A student with reading difficulty may have trouble in language art classes, for example, but not in physical education classes. A student with a hearing impairment may have more trouble hearing a topic that he dislikes compared to one that he liked that much. Because official descriptions of types or categories of disabilities overlook these complexities, they risk stereotyping the real live people whom they are applied to. Even the simplification might not be a serious problem if the resulting stereotype were complementary. Most of us would not mind being called a genius, for example, even if the description is not always true. Stereotypes about disability, however, are usually stigmatizing and not complementary. Uh, Still, the categorization of disabilities do serve a useful purpose by giving teachers, parents, and other professionals a language or frame of reference for talking about disabilities. They also can help educators when arranging special support services for students, since a student has to have an identifiable, nameable need if professionals are to provide help. Educational authorities have therefore continued to use categories or labels to classify disabilities in spite of expressing continued concerns about whether the practice hurts student self-esteem or standing in the eyes of peers. For classroom teachers, the best strategy may be simply to understand how categories of disabilities are defined, while also keeping their limitations in mind and being ready to explain their limitations, tactfully of course, to parents or others who use this label inappropriately. That said, what in fact are the major types of disabilities encountered by regular teachers? Well, let us talk about them one by one, beginning with the more common ones, and then we will talk about the value of inclusion later. Now, a learning disability, or LD for short, is a specific impairment of academic learning that interferes with a specific aspect of schoolwork and that reduces a student's academic performance significantly. An LD shows itself as a major discrepancy between a student's ability and some feature of achievement. The student may be delayed in writing or reading, listening, speaking, or doing mathematics, but not in all of this at once. A learning problem is not considered a learning disability if it stems from physical, sensory, or motor disability, or from generalized intellectual impairment, or what we used to call mental retardation. It is also not a learning disability if the learning problem really reflects the challenges of learning English as a second language, for example. Genuine LDs are the learning problems left over after these other possibilities are accounted for or excluded. Typically, a student with a learning disability has not been helped by teachers' ordinary effort to assist the student when he or she fails behind academically. Though, what counts as an ordinary effort, of course, differ among teachers, schools, and even students. Most importantly, though, a learning disability relates to a fairly specific area of academic learning. A student may be able to read and compute well enough, for example, but not be able to write. Learning disabilities are by far the most common forms of special educational needs, counting for almost half of all students with special needs in the Philippines and anywhere from 5 to 10% of all students, depending on how the numbers are estimated. Students with learning disabilities are so common, in fact, that most teachers regularly encounter at least one per class in any given school year, regardless of the grade level they teach. Now, with so many students defined as having learning disabilities, it's not surprising that the term itself become ambiguous in the truest sense of having many meanings. Specifically, or rather, specific features of learning disabilities vary considerably. Any of the following students that we are going to look at here, for example, qualify as having a learning disability, assuming that they have no other disease, conditions, or circumstances to account for their behavior. Let's look at the first student, Albert. An eighth grader has trouble solving word problems that he reads but can solve them easily if he hear them orally. Boy, for example, can solve word problems only when he can read them but not when he hear them. Emily, in 7th grade, has terrible handwriting. Her letters vary in size and wobble all over the page, much like a first grade or a second grader. Then you have Dennis, who reads very slowly, even though he is in 4th grade. His comprehension suffers as a result because he sometimes forget what he read at the beginning of a sentence by the time he reaches the end. Lastly, you have Irma. A 10th grader adds multiple digits as if they were single-digit numbers stuck together, like 42 plus 59 for her is equal to 911 rather than 101, though 23 plus 54 correctly equates for 77. Now, with so many expressions of learning disabilities, it's not surprising that educators sometimes disagree about their nature and about the kind of help students need as a consequence. Such controversy may be inevitable because learning disabilities, by definition, are learning problems with no obvious origins. There is good news, however, for this state of from this state of affairs, in that it opens the way to try a variety of solutions for helping students with learning disabilities. So, the question is, how do we assist students with learning disabilities? Now, there are various ways to assist students with learning disabilities, depending not only on the nature of the disability, of course, but also on the concept or theory of learning guiding a teacher. Take Irma, the girl we mentioned earlier, who adds two-digit numbers as if they were one-digit number. Stated more formally, Irma adds two-digit numbers without carrying digits forward from the ones columns to the tens columns, or from the tens to the hundreds column. Now, this image right here shows the effect that her strategy has on one of her homework or assignments. So, if as you can see, 3 out of 6 problems are done correctly, even though Irma seems to use an incorrect strategy systematically on all 6 problems. What's going on here, and how could we, as teachers, help Irma? Now, there are a variety of ways to look at this. The first is to look at it using the lens of behaviorism. One possible approach comes from behaviorist theory. Irma may persist with the single-digit strategy because it has been reinforced a lot in the past. Maybe she was rewarded so much for adding single-digit numbers like 3 plus 5 or 7 plus 8, for example, correctly, that she generalized this skill to 2-digit numbers. In fact, generalized it so much. This explanation is plausible because she would still get many 2-digit problems right, as you can confirm by looking at the example we presented earlier. Now, this explanation is, or rather in behaviorist terms, her incorrect strategy would still be reinforced, but not only but now only on a partial schedule of reinforcement. And as we know, partial schedule are especially slow to extinguish. So Irma persists seemingly indefinitely with treating 2-digit problems as if they were single-digit problems. Now, from the point of view of behaviorism, changing Irma's behavior is quite tricky since the desired behavior, that is borrowing correctly, rarely happens and therefore cannot be reinforced very often. It might therefore help for the teacher to reward behaviors that compete directly with Irma's inappropriate strategy. So, the teacher might reduce credit for simply finding the correct answer. For example, make increased credit for, an increased credit for a student showing her work, including the work of carrying digits forward correctly. Or the teacher might make a point of discussing Irma's math work with Irma frequently, so as to create more occasions when she can praise Irma for working problems correctly. However, behaviorism is not the only perspective we can use in looking at Irma's problem. The second approach we can use is metacognition. Part of Irma's problem may be that she is thoughtless about doing her math. The minute she sees number on a worksheet, she stuffs them into the first arithmetic procedure that comes to mind. Her learning style, that is, seems to be impulsive and not reflective, as we have discussed in the previous video. Her style also suggests a failure of metacognition. Can you remember the idea? Which is her self-monitoring of her own thinking and its effectiveness. Now, as a solution, the teacher could encourage Irma to think out loud when she completes 2-digit problems, literally get her to talk her way through each problem. If participating in these conversations was sometimes impractical, the teacher might also arrange for a skilled classmate to take her place some of the time. Cooperation between Irma and the classmate might help the classmate as well, or even improve overall social relationships inside the classroom. Lastly, you can look at Irma's problem using Constructivism. Remember Constructivism, Piaget and Vygotsky? Now, perhaps Irma has in fact learned how to carry digits forward, but not learning the procedure well enough to use it reliably on her own. So, she constantly falls back on the earlier better learned strategy of single-digit addition. Now, in this case, her problem can be seen in the constructivist terms. In essence, Irma has lacked appropriate mentoring from someone more expert than herself, someone who can create a zone of proximal development in which she can display and consolidate her skills more successfully. she still need mentoring or assisted coaching more than independent practice at this stage. The teacher can arrange some of this in much the way she encouraged to be more reflective, either by working with Irma herself or by arranging for a classmate or even a parent volunteer to do so in class. Now, in this case, however, whoever serves as a mentor should not only listen, but also actively offer Irma help. Now, the help has to be just enough to ensure that Irma completes two-digit problems correctly, neither more nor less. Too much help may prevent Irma from taking responsibility for her learning the new strategy, but too little may cause her to take the responsibility prematurely. Alright, so now that we have talked about learning disabilities and how to assist students with learning disabilities in the regular classroom, let's now move on to attention deficit disorder. Attention deficit hyperactive disorder, that is, or what we commonly call as ADHD. Is actually a problem with sustaining attention and controlling impulses. As students, almost all of us have these problems at one time or the other. But a student with ADHD show them much more frequently than usual, and often at home as well as at school. Now, in the classroom, the student with ADHD may fidget and squirm a lot, or have trouble remaining seated, or continually get distracted and off task, or have trouble waiting for a turn, or blurt out answers and comments. Now, the student may shift continually from one activity to another, or have trouble playing quietly, or talk excessively without listening to others. Or the student may misplace things and seem generally disorganized, or be inclined to try risky activities without enough thought to the consequences. Although the list of problem behaviors is obviously quite extensive, keep in mind that the student will not do all these things. It's just that over time, the student with ADHD is likely to do several of them chronologically, or rather chronically, or repeatedly, and in more than one setting. So, in the classroom, of course, the behavior may annoy classmates and even frustrate you as a teacher. It is important to note that classrooms are places that make heavy demands on not showing ADHD-like behaviors. Students are often supposed to sit for a long period of hours, avoid interrupting one another, finish tasks after beginning them, and keep their mind and materials organized. Ironically, therefore, classroom life may sometimes aggravate ADHD without the teacher intending for it to do so. A student with only a mild or occasional tendency for restlessness, for example, may fit in well outdoors playing soccer or playing basketball or playing other games, but feel unusually restless indoors during class. It also should not be surprising that teachers sometimes mistake a student who is merely rather active for a student with ADHD, since any tendency to be physically active may contribute to problems with classroom management. Now, the tendency to overdiagnose is more likely for boys than for girls, sadly. Presumably because gender role expectations, as we have talked about in the previous video, can cause teachers to be especially alert to high activity in boys. Overdiagnosis is also especially likely for students who are culturally or linguistically diverse. Presumably because cultural and language differences may sometimes lead teachers to misinterpret students' behaviors. To avoid making such mistakes, it's important to keep in mind that in true ADHD, restlessness, activity, and distractibility are widespread and sustained. Um, a student who shows such problem at school but never at home, for example, may not have ADHD. He may simply be getting along with his teacher, or he may simply not be getting along with his teacher or classmates. So let's look at what causes ADHD and how do we teachers help students with ADHD. Now, most psychologists and medical specialists agree that true ADHD, as opposed to mere intermittent distractibility or high activity, reflects a problem in how the nervous system functions. But then they do not know the exact nature or cause of the problem. Research show that ADHD tend to run in families with children, especially boys, of parents who had ADHD, somewhat more likely than usual to experience the condition themselves. Now, the association does not necessarily mean, though, that ADHD is inborn or genetic. That's quite confusing, I understand. But why? It is because it's possible that parents who formerly had ADHD may raise their children more strictly in an effort to prevent their own condition in their children. Yet their strictness, ironically, may trigger a bit more tendency rather than less towards the restless distractibility characteristics of ADHD. On the other hand, or is it on the third hand, the parents' strictness may also be a result as well as a cause of a child's restlessness. The bottom line for teachers is that sorting out causes from effects is a bit confusing, if not impossible, and in any case may not help much to determine actual teaching strategies to help the students learn more effectively. So the question is, how do we help them? How do we help students who have ADHD inside the regular classroom? Now, research also shows that ADHD can be reduced for many students if they take certain medications, of which the most common is methylphenidate, commonly known by the name Ritalin. Uh, this drug and other like it act by stimulating the nervous system, which reduces symptoms by helping a student pay better attention to the choices he or she makes and to the impact of action on others. Unfortunately, though, medications do not work on all students with ADHD, especially after they reach adolescence, and its long-term effects are uncertain. In any case, Ritalin and similar drugs have certain practical problems. Drugs cost money, for one thing, which is a problem for a number of families without much money to begin with. For or for a family lacking medical insurance that pays for medication, a particular common situation in the Philippines. For another thing, drugs must be taken regularly in order to be effective, including on weekends. Keeping a regular schedule can be difficult if parents' own schedule are irregular or simply differ from that of the child, for example, because of night shifts at work or because parents are separated or one parent is not around and share custody of the child. Now, in any case, since teachers are not doctors and medications are not under teachers' control, it may be more important simply to provide, number one, an environment where a student with ADHD can organize choices and actions easily and successfully. Clear rules and procedures, for example, can reduce the noise or chaotic quality in the child's classroom life significantly. The rules and procedures can be generated jointly with the child. They do not have to be imposed arbitrarily, as if the student were incapable of thinking about them reasonably. Sometimes, A classroom can enlist a model, can be, or rather a classmate can be enlisted to model slower, more reflective styles of working, but in ways that do not imply undue criticism to the student with ADHD. The more reflective student can complete a set of math problems, for example, while explaining what he or she is thinking about while doing the work. Sometimes, the teacher can help by making list of tasks of step in long tasks. It can help divide focusing or focused work into small, short sessions rather than grouping it into single, longer sessions. Now, whatever the strategies that you use, they should be consistent, predictable, and generated by the students as much as possible. By having these qualities, the strategies can strengthen the student's self-direction and ability to screen out the distraction of classroom life. Now, the goal for teachers, in essence, is to build the students' metacognitive capacities while at the same time, of course, treating the student with respect. Now that we have talked about ADHD, let's now move on to intellectual disabilities. Now, an intellectual disability is a significant limitation in a student's cognitive function and daily adaptive behaviors. Now, the student may have limited language or impaired speech and may not perform well academically. Compared to students with learning disabilities discussed earlier, students with intellectual disabilities have impairment to learning that are broader and more significant. They score poorly on standardized tests of intelligence. Everyday tasks that most people take for granted, like getting dressed or eating a meal, may be possible, but they may also take more time and effort than usual. Health and safety can sometimes be a concern. For example, knowing whether it's safe to cross a street for excuse me, for older individuals. Finding and keeping a job may require help from supportive others. Now, the exact combination of challenges vary from one person to another, but it always, by definition, involve limitation in both intellectual and daily functioning. Now, as a teacher, you may hear more than one term for describing students with intellectual disabilities. If the disability is mild, teachers sometimes refer to a student with disability simply as slow learners, particularly if the student has no formal special support for the disabilities, such as a teaching assistant hired specifically to assist the student. If the student is more marked, then the student is more likely to be referred to either as having an intellectual disability or as having mental retardation. We used to call intellectual disability as mental retardation, but after or with the advent of DSM-5, the psychologist's Bible, we no longer use the term mental retardation, and we now use the term intellectual disability, which is more inclusive and which is more, if you think about it, politically correct. Now, I will primarily use the term intellectual disability because it has fewer negative connotation while still describing one key educational aspect of the disability, that is cognitive impairment. Keep in mind, however, that actual intellectual disabilities are always more than cognitive. They also involve challenges about adapting to everyday living. So let's now look at the levels of support for individuals with intellectual disabilities. Now, intellectual disabilities happen in different degrees and amounts, though most often are relatively mild. Traditionally, the intensity or amount of the disability was defined by scores on a standardized test of scholastic aptitude or IQ test, with lower scores indicating more severe disability. Because of the intense insensitivity of such tests to individual daily social functioning, however, current trends are towards defining intensities by the amount of support needed by the individual. Uh, in Let us look at this table and see that yeah, the most common used scheme for this purpose, one created by the American Association in Intellectual and Developmental Disabilities. As you can see, levels of support range from intermittent or just occasional or as needed for specific activities to pervasive, meaning continuous in all realms of living. Now, as teacher or as classroom or general education teacher, the intellectual disabilities that you're more likely to see are the ones requiring the least support in your classroom. A student requiring only intermittent support may require special help with some learning activities or classroom routines, but not others. He or she might need help or rather with reading, putting on clothes, for example, but primarily on occasions when there is pressure to do these things relatively quickly. Students requiring somewhat more support are likely to spend somewhat less time in your classroom and more time receiving special help from other professionals, such as special education teachers, a speech and language specialist, or an occupational therapist or an assistant to these professionals. So these circumstances have distinct implication for ways of teaching these students. So let's now move on to how we can help teach students with special or with intellectual disabilities. Now, there are many specific techniques that can help in teaching students with mild or moderate intellectual disabilities, but most can be summarized into three more general strategies. The first is to give more time and practice than usual. The second is to embed activities into the context of daily life or functioning where possible. And the third is to include the child both in social and in academic activities rather than just one or the other. So let's look at all these ideas briefly. So first is to give them more time and practical or rather practice than usual. So if a student has only a mild intellectual disability, he or she can probably learn important fundamentals of the academic curriculum. So probably the person can learn basic arithmetic, for example, and basic reading. So because of the disability, though, the student may need more time to practice than most other students. He or she may be able to read many words by sight, day, night, morning, afternoon, for example, but need longer than other students to recognize and say them. Or the ability or the student may know what 2 plus 3 equals 5, but needs help applying this mathematical fact to real objects. You or a helper might need to show the student that 2 pencils plus 3 make 5 pencils. Giving extra help take time and perseverance and can try the patience try the patience of the student and probably you too. Now, to deal with this problem, it may help to reward the student frequently for effort and successes with well-timed praises, especially if it is focused on specific actual achievement. Like when you say you added that one correctly, may be more helpful than saying you are a hard worker, even if both comments are true. Giving appropriate praise in turn is in turn easier. if you set reasonable, doable goals by breaking skills or tasks into steps, that the student is likely to learn without becoming overly discouraged. So at the same time, it's important not to insult the student with goals or activities that are too easy, or by using curriculum materials clearly intended for children who are much younger than the person. Setting expectations too low actually deprives students with an intellectual disability of rightful opportunities to learn. A serious ethical and professional mistake, in my opinion. In many curriculum areas, fortunately, there are already existing materials that are simplified yet also appropriate for older students. Special education teachers, specialists, can often help in finding them and in devising effective ways in using them in your classroom. The second strategy that you can use is to use adaptive and functional skills. Students with disabilities or intellectual disabilities, that is, present especially clear examples of a universal dilemma of teaching. Since there is not enough time to teach everything, how do we choose what to teach? One basis for selecting activities is to relate learning goals to students' everyday life and activities, just as you would with all students. Now, this strategy addresses all other defining features of intellectual disabilities. The student's difficulty with adapting to and functioning in everyday living. In teaching addition and subtraction, for example, you can create examples about the purchasing of common familiar objects, for example, food, and about the need to make or receive change for the purchases. Similar considerations apply to learning new reading or oral language vocabulary. Instead of simply learning words in a basic reading series or reading textbook, try encouraging the student to learn words that are especially useful to the student's own life. Often, the student, not yourself, is the best person to decide what these words are actually are. So, an adaptive functional approach can help in non-academic areas as well. In learning to read or tell time on a clock, for example, try focusing initially on telling the times important to the student, such as when he or she gets up in the morning or when school starts. As you add additional times that are personally meaningful to the student, he or she works gradually towards full knowledge of how to read the hands on a clock, even if the full knowledge proves slow to develop. However, the student will at least have learned the most useful clock knowledge first. Lastly, you can include the student deliberately in group activities. The key word here is inclusion. Now, the student should participate in and contribute to the life of the class as much as possible. This means that wherever possible, the student attends special events, assemblies, field days, field demos, and such things with the class. That if the class plays a group game, then the student with the disability is part of the game too. That if the classmates do an assignment as a group, then if at all possible, the student is assigned to one group too. The changes resulting from the inclusions are from these inclusions are real, but can be positive for everyone. On one hand, they foster acceptance and helpfulness toward the child with a disability. Classmates learned that school is partly about providing opportunities for everyone, and not just about evaluating or comparing individual skills. On the other hand, the changes caused by inclusion stimulate the student with the disability to learn as much as possible from classmates, socially and academically. Among other benefits, group activities can give the students chance to participate and to practice belonging skills, how to greet classmates appropriately, or when and how to ask the teacher a question. Now, these are skills I might add that are beneficial for everyone to learn with or without disabilities. So, let's now move on to behavioral disorders. So, behavioral disorders are a diverse group of conditions in which a student chronically perform highly inappropriate behaviors. Now, since the classroom, or since there are a number of students inside the classroom too is a place of diverse behaviors. However, it's important to note that not all diverse behaviors, or what we call misbehaviors or mistaken behaviors, can be considered as behavioral disorders. We have to look at the characteristics of problematic behavior in order to understand the difference between normal inappropriate behavior, or inappropriate behavior because of the student's immaturity, or when inappropriate behaviors can be considered as behavioral disorders. All right, so in order to understand the difference, we have to note that problematic behaviors do have several general features in common. So, if you look at the slide, it says strategies for teaching students with behavioral disorders, but that's not yet the part of the lesson. All right, this is a typographical error. It should say general features common in problematic behavior. So this area is wrong, but the succeeding parts, the numbered parts are all correct. So the first characteristic or common feature, or a feature common in problematic behaviors, that they tend to be extreme. All right, they tend to be extreme compared to other misbehaviors or inappropriate behaviors. They also tend to persist for extended periods of time, and they tend to be socially unacceptable, which includes unwanted sexual advances or even the vandalism against school properties. They affect schoolwork too, and they have no other obvious explanations. That is, you cannot explain it because of health problems or temporary disruption in the family. Now, the variety among behavioral disorders mean that estimates of their frequency also tend to vary among schools, among cities, among provinces. It also means that in some cases, a student with a behavioral disorder may be classified as having a different condition, such as ADHD or a learning disability. In other case, a behavioral problem shows in one school setting may seem serious enough to be labeled as behavioral disorder, even though a similar problem occurring in another school may be perceived as a serious but not serious enough to deserve the label. In any case, available statistics suggest that only about 1 to 2% of students, or perhaps less, have true behavioral disorders, a figure that is only about 1/2 or 1/3 of the frequency for intellectual disabilities. Now, because of the potential disruptive effect of behavioral disorders, however, students with this condition are of special concern to teachers. Just one student who is highly aggressive or disruptive can interfere with the functioning of an entire class and challenge even the best teachers' management skills and patience. So it's important to look at some strategies for teaching students with behavioral disorders. Now, the most common challenges for teachers for teaching students with behavioral disorders have to do with classroom management. Here are some strategies for teaching students with behavioral disorders. Number 1, identifying circumstances that trigger inappropriate behaviors. that is dealing with a disruption is more effective if you can identify the specific circumstances or event that triggers it, rather than focusing on the personality of the student doing the disrupting. A wide variety of factors can trigger inappropriate behaviors, including physiological effects, including illness, fatigue, hunger, or side effects from medication. Uh, Physical features of the classroom can also influence the behavior of the child, such as the classroom being too warm or too cold, the chairs being exceptionally uncomfortable for seating, or seating patterns that interfere with hearing or seeing. Sometimes instructional choices or strategies can frustrate learning, including restricting students' choices unduly, giving instructions that are unclear, choosing activities that are too difficult or too long, or preventing students from asking questions when they need help. Now, by identifying the specific variable often associated with disruptive behaviors, it's easier to devise ways to prevent the behaviors, either by avoiding the trigger if it's actually possible, or by teaching the student alternative but quiet specific ways of responding to triggering circumstances. The second is to use teaching is to teach interpersonal skills explicitly. Because of their history and behavior, some students with behavioral disorders have had little opportunities to learn appropriate social skills. Simple courtesies like remembering to say please or thank you may not be totally unknown, but may be unpracticed and seem unimportant to the student. As might body language like eye contact or sitting up to listening to a teacher rather than slouching and looking away. Now, these skills can be taught in ways that do not make them part of punishment, make them seem preachy, or to put students to shame in front of classmates. Depending on the age or grade level of the class, one way is by reading or assigning books and stories in which the characters model good social skills. Another is through games that require courteous language to succeed. One that I recall from my own school days that was so long ago was called Mother May I. So still another is through programs that link an older student or adult from the community as a partner to the student at risk for behavioral problems. A prominent example of such program in the United States, I cannot remember if there's any similar programs that has been institutionalized in the Philippines, is the Big Brother Big Sisters of America, which arranges for older individuals to act as mentors for younger boys and girls. In addition, strategies based on behaviorist theories have proved effective for many students, especially if the student needs opportunities simply to practice social skills that he has learned only recently and may still feel awkward or self-conscious in using. Behaviorist techniques include the use of positive reinforcement and extinction, generalization, and the like, which we have talked about in an earlier lesson. In addition to these, teachers can arrange for contingency contracts, which are agreements between the teacher and the student about exactly what work the student will do, how it will be rewarded, and what the consequences will be if the agreement is not fulfilled. An advantage of all such behaviorist techniques is their precision and clarity. There is little room for misunderstanding about just what you want or what you expect as a teacher. The precision and clarity in turn makes it less tempting or necessary for you as a teacher to become angry about infractions of rules or a student's failure to fulfill contracts or agreements. So, since the consequences tend already to be relatively obvious and clear, keeping your cool can be especially helpful when dealing with behaviors that is by nature annoying and disruptive. So, Also, you should use fairness in disciplining. Many strategies for helping a student with behavioral disorder may be spelled out in the student's individual educational plan, such as the plan can and indeed is supported to serve or is supposed to serve as a guide in devising daily activities and approaches with the students. Keep in mind, however, that since an IEP or individual educational plan is akin to a legal agreement among teachers, other professional, and the student, and the student's parents, departures from it should be made only cautiously and carefully, if ever it is needed. Although such departures may seem unlikely, a student with a behavioral disorder may sometimes be exacerbating enough to make it tempting to use stronger or more sweeping punishment than usual. For example, isolating a student for extended times. In case you are tempted in this direction, remember that every IEP also guarantees the student and the student's parents due process before an IEP can be changed. In practice, this means consulting with everyone involved in the case, especially parents, other specialists, and the student himself, and reaching an agreement before adopting new strategies that differ significantly from the past. So instead of increasing the volume of punishment, a better approach is to keep careful records of the student's behaviors and of your response to these behaviors, documenting the reasonableness of your rules or responses to any major disruptions. So, by having the records, collaboration with parents and other professionals can be more productive and fair-minded, and increase others' confidence in your judgment about what the student needs in order to fit in more comfortably with the class. So, in the long term, more effective collaboration leads to both to better support and to more learning for the student, as well as better support for you as a teacher. So, now let's move on to physical disabilities and sensory impairment. Now, a few students have serious physical, medical, or sensory challenges that interfere with their learning. Usually, the physical and medical challenges are medical conditions or diseases that require ongoing medical care. The sensory challenges are usually a loss of either hearing or in vision, or more regularly in both. Now, whatever the specific problem, it is serious enough to interfere with activities in regular classroom programs and to qualify the student for special education services and programs. Physical challenges that are this serious are relatively infrequent compared to some of the other special needs we have discussed earlier, though they are, of course, important in the lives of the student and their families, as well as important for teachers to accommodate. Only about 1% of students have a hearing loss serious enough to be served by special programs for such students. Only about half of that number have visual impairments that lead them to be served by special programs. Two reasons, though, because of two reasons, though, these figures are a bit misleading. One reason is that many students have vision or hearing problems that are too mild, such as wearing eyeglasses for ordinary nearsightedness. Another is that some students with serious sensory impairment may also have other disabilities, and therefore not to be counted in statistics about sensory impairments. So, let's look at hearing loss. Now, a child can acquire a hearing loss for a variety of reasons, now ranging from disease early in childhood to difficulties during childbirth to reactions to toxic drugs. Now, in the classroom, however, the cause of the hearing is virtually irrelevant because it makes little difference in how to accommodate a student's educational needs. More importantly, or more important than the cause of the loss is the extent. Students with only mild or moderate loss of hearing are sometimes called hearing impaired or hard of hearing. Only those with nearly complete loss or are called deaf. So as with other sorts of disabilities, the milder the hearing loss, the more likely that you are going to encounter the student in regular classroom, at least for part of the day. Now, in principle, adjustment in teaching students with hearing loss are relatively easy to make, though they do not, or they do require deliberate actions or choices by the teacher and by fellow students. Interestingly, many of the strategies make good advice for teaching all students as well. So first is to take advantage of the student's residual hearing. Sit the student close to you if you are doing the talking, or close to key classmates if the students are in work groups. Keep competing noises such as unnecessary talking or whispering to a minimum, because such noise is especially distracting to someone with a hearing noise. Keep instructions concise and to the point, and ask students occasionally whether he or she is understanding. The next is probably you can use visual cues liberally. Make charts and diagrams wherever appropriate to illustrate what you are saying. Look directly at the student when you are speaking to him or her to facilitate lip reading. Gestures and pointing to key words or objects, but within reason, not excessively. Provide handouts or readings to review visually the points that you make orally. So you can also include the student in a community or a classroom. Recruit one or more of his classmates to assist in translating oral commands that the students may have missed. Now, if the student uses sign language at home or elsewhere, then learn a few basic important signs of sign language yourself. Hello, probably, thank you, or how are you? And you can even teach them to the classmates or to their classmates as well. So the next type of students with sensory impairment is students with visual impairment. So students with visual impairments have difficulty seeing even with corrective lenses. Most commonly, the difficulty has to do with refraction or the ability to focus. But some students may also experience a limited field of view called tunnel vision, so or be overly sensitive to light in general. As with hearing impairment or hearing loss, labels for visual impairment depend somewhat on the extent and nature of the problem. Legal blindness means that the person has significant tunnel vision, or else visual acuity or sharpness of vision of 20 by 200 or less, which means that he or she must be 20 feet away from an object that a person with normal eyesight can see at 200 feet. Low vision means that a person has some vision usable for reading, but often needs a special optical device such as a magnifying lens for doing so. As with hearing loss, the milder the impairment, the more likely that the student with a vision impairment or problem will spend some time or even all the time in regular classes. So students with visual impairment often show some of the same signs as students with simple common nearsightedness. The students may rub their eyes a lot, for example, blink more often than usual, or hold books very close to read them. Now, they may also complain of itchiness in their eyes, or of headache, dizziness, or even nausea after doing a lot of close eye work. So the difference between the student with visual impairment and those with ordinary nearsightedness is primarily a matter of degree. The one with impairment shows the sign more often and more obviously If the impairment is serious enough or has roots in certain physical conditions or disease, they may also have additional symptoms such as a crossed eye perhaps, a swollen eyelids. As with hearing loss, the milder forms ironically can be more subtle to observe and therefore the most prone to being overlooked at first. So for classroom teachers, the best strategy may be to keep track of a student whose physical signs happen in combination with learning difficulties and for whom the combination persists for weeks. So, how do we teach students with visual impairments? In general, advice for teaching students with mild or moderate visual impairments parallel the advice for teaching with students with hearing loss, though with obvious differences because of the nature of the student's disabilities. For one, you can take advantage of the student's residual vision. So if the student still have some useful vision, place him or her where he can easily see the most important parts of the classroom, whether that is you, the chalkboard, or a video screen, or a particular fellow student. Make sure that the classroom, or at least the student's part of it, is well lit because good lighting makes reading easier with low vision. You can also make use of handouts. Books and other reading materials have good sharp contrast, also helpful with visual impairment. Use non-visual information liberally. Remember not to expect a student with visual impairment to learn information that is by nature only visual, such as the layout of the classroom, the appearance of photographs in textbook, or the storylines in a video. It's also hard to teach colors. So you can explain this to students somehow. Use hands-on materials wherever they look or they will work, such as maps printed in three-dimensional relief or with different textures. If the student knows how to read Braille, which is an alphabet for the blind using patterns of small bumps on a page, allow him to do so. So, as with students with hearing impairment, it's important that you include students in the classroom or in the community. So make sure that students is accepted as well as possible, into the social life of the class. Recruit classmates to help them explain visual materials when necessary. Learn a bit of basic Braille and encourage classmates to do the same if possible. So even if none of you ever become as skilled with it as the student himself or herself. So yeah, that ends our discussion of the types of learning disabilities. Now let's move on to why is inclusion so important. So I already have hinted it already in this video, but it's worth saying again. Including students with disabilities in regular classroom is valuable for everyone concerned. The student with disabilities themselves tend to experience a richer educational environment, both socially and academically. Just as with racial segregation, separate education is not equal education, or at least cannot be counted on to be equal. But classmates of students with disabilities also experience a richer educational environment. They potentially meet a wider range of classmates and to see a wider range of educational purpose in operation. Teachers also experience these benefits, but their programs often benefit in other ways as well. So the most notable overall benefit in an increased focus on diversity among students is the presence of students with disability reminds everyone, students as well as teachers, that everyone is truly unique, whether or not they are officially designated as having a disability. Many teaching strategies help students with disabilities precisely because they are individualized and differentiated among students need more than conventional whole group teaching practices. Now, the differentiation turns out to be benefit to all students regardless of their level of skill or readiness. Everyone, Not just students with disabilities benefit from careful planning of objectives, attention to individual differences among students, and establishment of a positive social atmosphere in the classroom. But at that point, we will frame the need for differentiated instruction around the need of all students, whatever their individual qualities are. So this ends our lesson in Student with Special Needs. My name is Dex Camitan, and thank you for watching.